Hey, this is Dr. Kimberly L Evans from Kimberly Medical Spa. I'm here to talk to you about something. From time to time, I just wanted to do a quick talks regarding different stuff that gynecologists face every single day, and more importantly, how this benefits you as a patient. So the other day, I was meeting with a patient who didn't want to do a pelvic exam. She was coming to me for a GYN consult. So I thought to myself, gosh, so how am I going to get to the right answers if we don't do a pelvic exam? So I just want to let you know, for any of those who may be shy or who may be on their period or who may be like, oh my goodness, I have this terrible discharge, don't examine me. I'm going to tell you it's really actually important for your gynecologist to be able to see this. And it's actually important for certainly doctors in general, but we are specialists at what we do. We know the best about the female pelvic anatomy. This is what we're trained on. This is what we see day in and day out. We see the best of it, we see the worst of it. So let me tell you, in terms of a good pelvic exam, what your doctor needs to do, they're going to be examining the outside. We're going to be looking for any sort of abnormalities here with the skin, any problems here. We're going to be looking into the vagina, making sure that there's no abnormal masses, there's no obvious pathology that's there. Inside here is the cervix. We're going to be looking at the cervix again, making sure there's no masses that are there. Believe it or not, anything like vulvar, cancer, melanomas, things like that can actually be picked up by the exam. Things like genital warts, those are also things, or syphilis, those are also things that we can see with our eye to let us know that, hey, there's a problem or there's some other pathology going on in your body that needs to be evaluated. We're also looking for any sort of abnormal discharge within the vagina. For example, is it like kind of white and creamy? Is it green? Is it bloody? Is there clots in there? And then the other thing that we're doing during the pelvic exam is that we're actually examining the uterus. We're looking to see how big it is. Is it smooth? Is it a regular shape? Is there any evidence of any sort of fibroids or any other problems that's there? We're also looking at, well, what's the relaxation? And what I mean by that is that there's some people who actually will have pelvic relaxation in this area to where literally their pelvic floor is falling, and that's something else that can lead to pelvic pain and other problems that can come with intercourse. So the other thing that we're looking for is that we're actually palpating the ovaries. We're actually seeing, are there any obvious masses or anything that's there. Sometimes this exam, of course, can be limited to someone's body habitus, but then again, it's really important. So please, for all you people out there, let your gynecologist examine you. We're specially trained at this. Again, this is Dr. Kimberly L Evans just talking to you about the importance of a pelvic exam. And by the way, too, for any of you who had questions on how often you should be performing this, I would recommend doing this once a year. Certainly, this is different from an actual pap smear. The pap smear actually just screens for cervical cancer, but your pelvic exam is something that lets your doctor know that, hey, we're healthy on the inside, okay? Thank you so much for tuning in. Again, this is Dr. Kimberly L Evans from Kimberly Medical Spa. Thanks. Have a great day.